So we'll be looking at the differences between endometriosis and endometritis because a lot of people find these terms confusing. So we'll be looking at differences based on definition. So endometriosis is the presence of endometrial tissue, that's glands and stroma, outside the uterus, for example on ovaries, fallopian tubes, or even the peritoneum. So you can see the endometrial tissue here, which is supposed to be around the inner layer of the uterus, is now outside the uterus. You can see it on the peritoneum, on the ovaries, and on the fallopian tube. Why endometritis is inflammation of the endometrial lining inside the uterus, usually due to infection. So you can see the endometrial lining inside the uterus here inflamed as a result of infection. So based on cause or etiology, endometriosis, the exact cause is unknown. It could be possible because of retrograde menstruation, hormonal, genetic, or immune factors. While endometritis is most commonly bacterial infection after birth, miscarriage, abortion, or intrauterine device use. Common organisms involved are chlamydia, gonorrhea, streptococcus, and E. coli. Based on nature, endometriosis has a chronic, non-infectious, hormone-dependent disorder nature, while endometritis has an acute or chronic infectious inflammatory condition nature. Based on pathophysiology, endometriosis is because ectopic endometrial tissue still responds to hormones, bleeds during menstruation, which will result into inflammation, scarring, adhesion. While endometritis infection causes inflammation of the uterine lining, resulting into edema, pus formation, and tenderness. Based on complication, endometriosis results into chronic pelvic pain, infertility, adhesion, and organ distortion, while endometritis will result into infertility if chronic, pelvic inflammatory disease, sepsis if acute and severe. Based on common sites, endometriosis occur on the ovaries, fallopian tubes, uterosacral ligaments, pelvic peritoneum, rectovaginal septum, while endometritis occur on the endometrial cavity, that's the inner lining of the uterus. Based on main symptoms, endometriosis presents with pelvic pain, especially premenstrual, presents with dysmenorrhea, that's painful periods. It presents with dyspareunia, that's painful intercourse. It presents with infertility and chronic fatigue. While endometritis presents with fever, lower abdominal pain, foul smelling vaginal discharge, uterine tenderness, abnormal bleeding, especially postpartum or post-abortion. Based on fertility impact, endometriosis results into major cause of infertility due to adhesions and tubal blockage, while endometriosis can lead to infertility if chronic and untreated due to scarring of endometrium. Based on diagnosis, endometriosis, laparoscopy is the gold standard of diagnosis. Ultrasound/MRI can also be used. Elevated CA125 sometimes can be used. While endometritis, you do endometrial biopsy or uterine swab. You do an ultrasound. Here it could be thickened or irregular endometrium. There's elevated white blood count or C-reactive protein. Based on treatment, endometriosis is treated with hormonal therapy, that's OCPS, GnRH, and agonist, that's gonadotropin releasing hormone agonists, progestins, analgesics for pain, surgical removal of lesions if severe, while endometritis is treated with broad spectrum antibiotics, e.g., clindamycin plus gentamicin plus doxycycline plus metronidazole. Treat sexual partners if STI related. The key difference between endometriosis and endometritis is that endometriosis involves ectopic tissue growth outside the uterus, while endometritis involves infection and inflammation inside the uterus. Thanks for listening.